Hi YouTube, my name is Amity, and I'm here to share with you all how it is to be down with COVID with children. I found out I had COVID. Today's Thursday, Tuesday night. I was at work that day, and I feel like I was having sinus problems. I don't have sinuses or allergies. That's what it felt like, allergies. I kept blowing my nose and sneezing that day. And it was weird. And I work at a center addiction treatment for people that comes in who needs to detox or withdraw from drugs and alcohol. And I'm sitting there sniffling. I'm like, I hope they don't think, I have a problem, because I'm sniffling. And one of my patients asked me about allergies. I'm like, I don't know if I have allergies or not, but that's definitely what it feel like. So I get home that night. My nose started to get, I keep feeling out of breath. My nose started to get congested that night. And I just started to feel under the weather more and more as the night went on. So after a couple hours after being home, I go and take a shower. And I started feeling a little bit better, because I take hot showers. And the steam was like clearing up my sinuses or whatever. But I started to get a headache. And the first time I ever had COVID, it started with a headache. So I'm like, oh my gosh, I hope I don't have COVID. So when I get out the shower, I have some home tests, COVID home tests here. And I took one that looked like pregnancy test. Made it seem like I was taking a pregnancy test. But anyway, I take the test, and y'all, when I tell you, it showed up. I say to wait 15 minutes before reading. When I tell y'all, it was positive within like 2 minutes, and that line was so dark. Sound like a pregnancy test, huh? But that line was so dark, and I'm like, oh my goodness, I got COVID. Yep. So the next day, I had to send the results over to my boss, and she told me to stay out of work for a week, so I don't return back to a week after the first day. It's a week after the first day of feeling symptoms. So Tuesday was the day I started feeling symptoms. So I return to work next Tuesday. Yesterday I go to excuse me. I know y'all like, cover your mouth. Yesterday I go to, those coughs be coming out of nowhere. Like, I don't even be knowing when it's about to happen. Yesterday I go to urgent care, and this video gonna be so boring because I can't even get out what I'm trying to say. But come on. Um, Yesterday I go to urgent care, and of course it was positive. I only went to urgent care just so I could have a written statement saying that I do got COVID, because I don't be wanting people to think I'm lying or whatever. I want them to think I'm just trying to be off work or whatever. But I go to urgent care and get the written statement saying that I have COVID. But that doctor tells me that you good after 5 days. First to go from 2 weeks. Remember, y'all, when it used to be 2 weeks you had to be quarantined, and then it went to 7 days to be in quarantine. He told me it went to 5 days to be in quarantine, and he said that if I feel better at 5 days, I should be fine. Just make sure I wear a mask and I can return to work 5 days after the onset of symptoms. So, oh, and he also said that, if I start feeling like I'm coming down with a fever, because I don't think I've been having a fever, but it's been hard to tell anyway, because I'm taking cold and flu to help with the body aches. Because oh yeah, that's another one I forgot to mention. I've been having body aches. So, this is the most talking I've done. So he said after 5 days, if I hit the 5th day mark and I come down with a fever, then I need to quarantine for another 5 days. And then after that 5 days, I should be good. But just make sure I wear a mask for an extra 5 days. So, yeah. But I sent that over to my boss, and she said thank you, whatever. But anyway, being a mom with COVID, oh my God, I can't keep them out my room. So I'm praying that my babies don't get sick. I have a 1-year-old, y'all. I have a 1-year-old, and I'm still nursing her. So she's always in my face. She stay in my face. She stay up under me. She won't leave me alone. So, having COVID, even a flu or a cold, but having COVID, the one that you're really supposed to be quarantined, and having kids in your room while you coughing, hacking up your lungs, constantly coughing, constantly blowing your nose, it's not easy. It's not easy, especially when you don't really have the help you need. Now, I am married, but my husband is at work. He at work, so when he get home, he try to take over, but yeah. Anyway, and then I have a 19-year-old daughter here, but she's pregnant. So she is 38 weeks pregnant, and I'm trying my best to keep her from getting sick. She just stay in her room. She don't even come out her room. And I told her that if she do come out, to wear a mask, because I have to roam the house. I have to go fix things for the kids. They hungry, So, so I know COVID is just all through my home right now. The mask don't really, is not 100%, liable. You can hold it up, but you still got this right here. This right here, it still can come up here. So, especially if I'm downstairs and I cough, I can't control the cough. So sometimes I don't even know I'm about to cough, and I start coughing, I gotta do like this to keep, you know what I'm saying? Try to keep it from. And then I contaminate this with the coughing. So, and it's my only mask. I grabbed one yesterday from urgent care, but I gave it to my daughter so that she can wear a mask when she come out of her room. I don't even know if she been wearing that mask, I hope, because if she don't want to be sick with COVID while she pregnant. I did that. My 1-year-old, when I first had COVID, I was pregnant with her, and it was terrible. When I tell y'all, I thought I was gonna die. Nope. When I tell y'all, I thought I was going to die. I thought I was going to die. And I was sick for like 2 weeks. Was it a week or 2? It might have been 1 week. Y'all, I had the worst body aches. I had a a terrible cough. Like, I was constantly coughing. And mind you, I'm 8.5 months pregnant with my daughter. Coughing, hacking all day and night. Runny nose, phlegm, body aches, headache. Oh, it felt like it felt like the flu times 2. That's what it felt like. And I'm up in my room. I never left my room. I'm up unless I had to use the bathroom. But I'm in my room, y'all. I felt like nobody was checking on me, y'all. I was just there, pregnant. And so I was just always asleep because I was taking cold and flu nighttime. So I was just always asleep, you know. And my husband, he would bring me food. But that was the only time I seen him. Of course, I got COVID, you know. He claimed, I had to stay away from you. But didn't nobody check on me, you know. It was terrible. And then I come to find out my daughter, she was in a lot of stress. She was in distress from the coughing that I was doing, because that's all I did was cough. So she was in distress. I went to have an ultrasound done. My baby would not wake up. She wouldn't move. She had a heart rate, but she wouldn't move. And I noticed that she wasn't moving. She hadn't moved in like 2 days. And so they admitted me in the hospital, and I ended up, I think I was in labor. I was in early labor, and I ended up having her 6 weeks early. Because I had COVID, and it put me in early labor, and they had to do. My doctor claimed that my baby's heart was decelerating, so she did an emergency C-section, but I really don't believe that, because she was talking about giving me a C-section the whole time I was pregnant. And when I get in there, they asked me, do you want a C-section? I said, no, but my doctor keep telling me. They was like, it's your decision. I said, well, I don't want a C-section. So I think she was mad about that and said my baby's heart rate was decelerating. And I ended up having to have a C-section, y'all. So, yeah, but having COVID with kids and no help at home with you, it's not easy. It's not easy being sick, getting up, having to go downstairs, fix them something to eat. So yesterday, what was my life like yesterday? I made them cereal. After that, they really didn't eat until their dad got home, because I didn't feel good. You know, I was just in the bed all day until I went to urgent care. Yes, they were hungry. But they were good. They were okay. Sometimes kids just be wanting to eat. Here go my 1-year-old. What's on your hand? What is that? You writing on your hand? Stop giving her an ink pen, y'all. So yeah. So today, for lunch, I'll have my 9-year-old. No, I'll just go down there and put some pizza rolls or something in the oven. I think they got pizza rolls. Is it chicken tenders? Stop. Say hi.
Hi.
What's your name?
Name.
Say Zakaya. Say Kaka. She's taking over the video.